Members, any pleasure there?
Adoption. Second.
All in favor? The minutes from our April 29th, 2025 meeting. Movement there.
I move adoption. I'll second.
All in favor? Next, we will have a presentation of our fiscal 2025 monthly financial update by our finance. Burnett, afternoon.
Good afternoon. I hope everybody's doing okay this afternoon. So there were a few changes this afternoon or this month with the presentation, and some of the changes were as requested, and I hope I was able to answer some of the questions that some of you had. On that note, so let me explain a little bit about the format that we have today for not only for you, but also for the community and the members present here. So I have, of course, a table of content, and what I try to do in this presentation is to actually summarize by major fund where we are year to date and where we are for the month. In addition to that, I have just a glance of what the month of April, and that's the one we're talking today about. So what the month of April looks like. And then in addition to that, I have tables for every major fund where we have the fiscal year 25 that was approved, the actual numbers, and also the remaining balance from that budget. In addition to that, I have also fiscal year 24, so it can serve as comparison between 24 and 25, and then there's the percentage column as well. So what I would like to do is start with the major fund balances, and we can start talking about revenues and expenditures within those revenue balances. So we are on page 8. So this is a general fund, and again, this is as of 4/30/2025. And these are all the revenues that we have in the general fund. So if I'm looking at the subtotal revenues, we have approved, or we're anticipating to get a revenues of $48 million. So far, we have received about $43.7 million. That is a difference of $4.5 million. So one of the things that I want to bring to your attention, most of our revenues normally come on the last 2 quarters of the year. So we still have 2 more months to continue receiving revenues. I do want to bring to your attention the property tax line. As you can see, we were projecting $18 million, and we are a little bit higher than that. We actually are over $650,000 over what we were projecting. We still have, again, we have 2 more months, so we're thinking that we're probably going to get at least $200,000 more to finalize the year, but this is our projection based on what we have seen from last year. So we are, again, we are 4% higher than what we were estimating compared to last year, to 2024. In addition to that, we have our local accommodations tax. Again, we still have 2 more months, and we are below what we were projecting in revenues for our local accommodation tax. So we are about $600,000 less than what we were projecting. Again, we still have 2 more months. Another one that I want to bring to your attention is the business license. We have a deadline. Our business license applications are due April 30th. And again, this report is as of April 30th. So we still have a stack of applications that we're still reviewing, that we're still trying to process. So not all revenues associated with business licenses have been posted yet, nor all the applications have been completely reviewed. So we still have a few of those left. So that is the difference, again, the remaining balance that we have there that we are expecting to receive in this last 2 months is about $2.5 million. Then you have the franchise fees and you have the permit fees. Those are coming a little higher than what we were projecting. The same thing for the intergovernmental also revenues. One thing that I do want, and I'm going down on the investment income side, we were very conservative in what we were expecting to earn in investment income for the year. We were projecting about $1.5 million, and actually we have surpassed our projection and is now close to $2.1 million, which we are over by $579,000, which is an increase of 19%. So if we continue the way we are, not only with the general fund, but also with all the other funds, last year I mentioned that we were about almost close to $11 million in investment income. Of course, things in our economy have changed, interest rates have changed, but so far it sounds to me that we are going to be very close to what we had last year as it relates to investment income. Again, we have 2 more months. And then, of course, the bottom part is the transfers that we have done so far, the transfers in. So altogether, the general fund shows an increase or a $17 million increase compared to 2024. Again, we are still expecting about $4.75 million in revenues. Any questions so far as it relates to the general fund?
Questions?
Burnett, thank you. Appreciate all the explanation. So it sounds as though, I mean, when you look at these numbers this time of year, we've got May and June left, 2 months. And this is when I start getting a little, moving around in my seat, getting a little nervous. But what I'm hearing from you is that you're not alarmed at this point, that we'll come in fine. And certainly there have been some incredible increases here. But let's take the local accommodations tax. The projections there, what are you thinking? There's a 40% difference comparing year to date, year over year. So are we going to get a bunch more money in from local aid tax?
As you can see, in 2024, you have about $4.5 million in actuals that we have received in 24. So obviously, when we were doing our budgets for 2025, we were more optimistic and we were thinking about that we were going to actually, based on our economy, our island, it seems to me, and I'm saying it seems to me because I wasn't here during the 2025 budget when we were putting the numbers together, but it seems to me that when we did the analysis, we were projecting about 6.9. And it's actually very close compared to 2024. The actual is 6.3. So there's a chance that we can potentially either match the budgeted number or a little bit less. At this point, I don't have enough information to tell you that, yes, we're going to meet $600,000. But again, it's way higher than what we had in 2024.
I just don't know when that money comes in, so maybe a lot of it is going to come in May and June.
And I'm sorry for interrupting. The local accommodation tax is a quarterly. We receive from the state the revenues on a quarterly basis. So we should be expecting to get the revenue sometime in June. So even in May, when I give you next month, when I come next month to talk about the month of May, you probably are not going to see a big change from this number. Again, June will be the time when we will be receiving it from the state.
Maybe we could take a look at how much money from, for instance, local aid tax came in, during the last quarter, so that we have an idea of how that compares to what we might hope to expect for this year.
Okay.
We've heard that some of the occupancy is down, and so that would affect our accommodations tax. And maybe we don't see that full picture yet because we're not into the peak season. Memorial Day definitely is the beginning of peak season for us here. So maybe comparing the last 3 quarters of last quarter of last year, last 3 months of last year might be helpful to look at.
Yes, so let me bring for you next month. Let me give you actually a breakdown of our local accommodation tax for the quarter for every quarter that we have this year, so you can see how much we have received. And I can do also a comparison against 2024 and see how they compare. See when we got the majority of the funding, how do we compare quarter by quarter, so I can do that for you for next month.
And it might be good to see that also for any other big differences, so to speak.
Okay?
I am positively encouraged by what we're seeing in property tax. That's a good sign and a reflection of what's happening out there in the economy, as well as permit fees, which is another reflection of activity that's happening within the community regarding construction and such. It'll be very interesting when business licenses come in to see where we are as well, because that also is a good indicator of what's happening on our island.
That's true. Yes, so I'll be glad to bring the quarterly information analysis for all the major ones that we have here on this table, specifically the one for local accommodation tax. Then this is the other side, what I call the other side, which is the expenditures portion. On this one, of course, we have, we projected for our expenditures for the general fund, we projected about $62.5 million. Year to date, we have spent $45 million. We have encumbered $3 million, so we have remaining of our budget about 14.3. So how do we compare to last year? We are significant lower than the year before, so we are 0.9% less than what we spent the year before. Again, I don't see any concerns or issues as it relates to our expenditures here. So far, it is on trend based on what I have seen and the numbers, how they're coming. And of course, we are being very diligent as it relates to our expenditures, especially towards the end of the year. The next one is the CIP fund. Again, this is our capital improvements program. So we have here, and something that I do want to bring to your attention, and is something that we probably need to change the way we report this, because we're looking at the traffic and park impact fees, and I'm looking at the budget that we have for $947,000, and I'm thinking, why do we have a budget for $947,000 compared to 2024 when the actuals were only 221? So that would raise the questions. And the reason why is that we should be using a line called prior year funds, because that's what in reality is. We actually are moving from our fund, from our traffic and park impact fee fund, and we put in it here to pay for CIP projects. And I can tell you the $947,000 that you see there is actually paying for a project, and that's for the Main Street enhancement. So instead of reflecting it as a prior year fund line, we actually put the amount that we're planning to spend for that specific project under this revenue line. And it's the same situation with the Sunday liquor permit. If you look at the budget for $1.5 million that we are projecting for 2025, and you compare that against the actual for 2024, you see a $246,000. That is a huge difference, and that's what that remaining budget shows, 1.2. And that one is the same situation. We move prior year funds, and actually this is for the Crossings Park renovation project, which is we're estimating about $1.5 million. Again, this is the way it's being reported here is going to be a little different for the next months and for next year. We're going to actually put it under prior years rather than put it as a line item like it shows here to avoid any kind of confusion. The HTAC supported lease, I don't know if you remember, I think it happened either early May or I went in front of you of the committee to talk about the lease trucks. That's what this number is. We were projecting that we were going to be able to get all the trucks, all the fire trucks and everything, and that's what we were projecting to get $11.4 million as revenue for the fire trucks. And we are only going to attempt to do the $8 million rather than 11. So that's why this number is the way it is, because we were projecting that we were going to get all the trucks, that everything was going to be, we're going to do at least for $11 million. We were going to get that revenue. So that is not the case. Trying to see other things that I need to bring to your attention as well. Again, transfers in are still nothing major there to discuss. Everything, again, our approved budget is about $82.8 million. We have the actual, we have $24 million, and then the remaining is 58. Again, this is compared to where we were last year, at the same period of time, we had an actual expense of, actual revenue, of $29.2 million compared to 24, so that's a 16.9% decrease in what we were projecting with transfers in and the revenues that we have here. Any comments, questions on this page?
Maybe I'm getting ahead of myself, but as you mentioned, the H-tax of $11 million is for the lease program that we
That's correct.
approved, and so it shows up as revenue. And then that money gets moved back into the H-tax account. It doesn't show up in expenses, but just increases our fund balance in
That is correct.
H-tax. Okay.
That is correct, because when we originally paid for the trucks, they came out of the H-tax fund. So when we get the lease and we get the proceeds from the bank, then they will go back to the same fund.
So we had expense in another year, prior year, we're getting the money for the lease in the current year, and then we're paying ourselves back.
Exactly.
Yeah,
Yes.
okay.
Bottom line is, we're still gonna get fire trucks whenever they can come, and we have money for them.
Yes, we have received, and I know our fire chief is here, and he can probably tell you that the fancy, shiny, beautiful trucks we have received, we're still expecting a few more. So again, the thinking is that we probably will be getting the remaining probably towards the end of 26 or even 27. One thing, and this is an update unrelated to this, we are actually sent our request for proposal out. So we are expecting now for financial institutions to come back to us with a proposal. So that's supposed to be closing on June 4th as it relates to the lease agreement that we're trying to put in place. This is the expenditures on the CIP fund. Again, the way I have it here is by programs, not by project. I'm also incorporating here, and I know we're talking the month of April, but we just had a budget amendment for 25 to incorporate the land acquisitions of 5.9. So that's why that number that you see there for total expenditures for 25 is a little higher than the number that you probably are used to seeing. So it does have $5.9 million for the land acquisitions that we have. So 88.7 is the new revised budget amount or budget for 2025. If we look at the actuals, we have about $23.4 million, and then so far we have encumbered $15.2 million. So altogether, we are still on target. The remaining is $50 million for our budget. Again, compared to last year, if we're looking at the actuals for 24 versus 25, we are a little higher by 8.9%. Again, we have paid more vendors, we have paid more invoices, so that is why it's reflected a little higher compared to last year. Comments, questions on this?
Pardon me, with regard to the beach program, I see almost 20 million left in there, but was that allocated for our beach renourishment program? Because we thought it would start earlier this year, and so that'll be carried over since it won't start until maybe August, I think, at this point.
Yes, so we have for the budget for the beach renourishment is about $16.5 million. So we're not going to utilize $16.5 million. So most likely we'll be carrying forward potentially about $15 million for 2026, and that is part of our fiscal year 26 budget proposal. Yes.
This is a good slide.
Oh, good.
I think this slide will continue to get better now that we are transitioning into more of a five-year outlook. The CIP expenditure burn rate, as I like to speak, looked at the actuals for 25 versus 24, you'll see that there's an increase there. So we're doing a little bit more, but the encumbrance is where I'm really excited about, that the stuff that's in the works that we have moving,
Yes.
and not just necessarily promising money to be spent. It's actually allotted to a particular project. So this is a good slide. And again, I just have a grave expectation for this to continue to get better. Thank you.
Yes, and I will be coming to you probably sometime in August, September to talk about what is the carry forward and to get your, actually the town, you and the town council, the whole town council's approval for the carry forwards for CIP.
Good.
The next table is in relation to the debt service fund. Again, here, this is the debt, the property tax, the debt service portion of property taxes is reflected in here. And as Ms. Stoller mentioned earlier, property taxes are coming up higher than what we were projecting. It's the same situation here. Our revenues are higher by 621.7 for property taxes, which is higher than expected. And then again, investment income is also coming higher than what we were projecting, which is about $201,000. And again, of course, we have our transfers. And then if you compare 24 against 25, we have $11.1 million versus $12 million, which is a little lower than where we were the year before. But so this is just it could be the transfers in that we probably reduced transfers in. So I'm not concerned about the minus 7.2. It's really not a reflection of where we are revenue-wise as it relates to the debt service. Comments, questions?
Anything there?
I see under tax increment financing, or TIF, just under 3.9 million remaining in the budget. And I know we're going to be dealing with the TIF under new business, so I'll defer any questions about that, but it'd be helpful to understand how that's working with that new business item that we have coming up.
And something, and just to give you some information about TIF, and this is nothing to do with what Mr. Collins is going to be presenting, or is related, but it's not. Since we're getting so close for the TIF to expire on June 30th, one of the things that my team we're doing is actually what I call reconciling the TIF. So we got an extension. Our extension, the second reading happened in 2014. And then it went live in 2015. So it's a 10-year extension. And we have reconciled the TIF in relation to how much money have we received, how much money have we spent, what projects have we done within the TIF. Because one of the things that we want to do when we finish our partnership with the county, with the school district, and the other partners, is for us to have clear understanding of where we are with the TIF. We also started having discussions with the county and the school district to talk about your records, do they match what we have, yes or no? And I'm happy to report that their records and our records match. So we are on track for closing our TIF. Of course, it's not going to happen until we finalize the utilization of TIF money. In addition to that, we're still expecting from the school district a little bit more. So that's the status on the TIF. We are working on making sure that our numbers are where they need to be reconciliation-wise.
And I don't want to get too far ahead in regards to that TIF piece, but I really like the idea of going through. I commend you for going through and reconciling everything and working with the other entities to make sure that everything is proper and aligns. And I think when we're done with that TIF, it would be a great exercise to, as we used to call them in work, a postmortem, to lay out exactly like you said, this is what we said we wanted to do with the TIF. This is what we've actually done. And I think it's a great opportunity to talk about it with the public so that they can see how the program works, what benefit it provides, and how we've used it in the past to invest in our community. It's not something I think a lot of people are familiar with, and this one is quite old. And so some of us weren't living here on the island at the time or involved in government, and I think it'd be a great exercise to educate the public.
So I have a question for the three of you. Do you think this should be like a workshop? We're talking about TIF, we're talking about what it is, how it works, and then at the same time talk about what we have done and the projects that we have developed because of the TIF money. Is that something that should be a workshop or should be something different?
Let me ask the question, Ms. Burnett. We are scheduled to have many workshops after we agree on the new strategic plan. And if I remember correctly, one of those workshops is going to be around alternative funding sources. Yes.
That is correct.
So, I mean, if it's the committee's pleasure, I would ask staff to be well prepared during that session to talk about TIF so that we have a deeper understanding of it, because I think it is something that we all want to understand and be in a position to say yes or no if that's indeed a route that we want to take for alternate funding sources.
So we will incorporate the TIF component if everybody's in agreement to the debt funding workshop that we have planned. Okay.
Good.
Yes, agreed. In fact, that's what I would have said if I could have read his mind.
That could be dangerous sometimes, so,
Right.
okay. The next slide is in relation to our debt service expenditures. As you can see, we have paid, year to date, we have paid some bonds principal for beach preservation bonds, and also some interest as well for include both the general obligation bonds and the special obligation bonds. So that's what that is. And of course, there's some bank fees that we do have to pay. So altogether, if we compare 25 to 24, we are below 7.6%, which is not significant as it relates to this. We are still paying our bond obligations. We have the next bond obligation that we have is coming up in June, so it would be June 1st. And then if you, of course, approve our fiscal year 26, then we will have some callable bonds that are coming on August 1st. Questions on this table?
Anyone? This one? Good.
And then we have the stormwater fund revenue. On this one, of course, our stormwater utility fees are coming higher than what we projected by $235,000, which is an increase of about 2.3%. And then we have our investment income, as you can see, is also coming higher than what we projected, which is wonderful. Again, it's 4.6%. Compared to the year before. And then we have also planned review fees that are coming higher than what we projected. So altogether, there's an increase of 3.9% for revenue for the stormwater. Comments on this one? Okay. The next one is the stormwater fund expenditures. On this one, again, compared to the year before, we are trending for the actual lower. And then we have encumbered about $1.6 million, which we still have a remaining budget of about $4.5 million as it relates to stormwater. Nothing here to point out unless you have any particular questions about any specific line here.
Just a comment, with all the focus on stormwater, and it's a little disappointing to see that we haven't spent or encumbered more money on the POA systems corrective maintenance. There's a lot of need out there. I know there's a long list, and it probably has more to do with capacity of time than the money, because we have the money to spend it, but, we're not there yet. But we know that there are needs across the island.
And it does show that the town has not run out of money with regard to stormwater.
No.
Correct.
No, we're still on target, and actually, we have 4.5 remaining in our budget.
Picking up on a little theme here, so I guess I'll comment as well. I would encourage
Yes.
the public to pay attention to this as we move to second reading of our fiscal 26 budget. We've had a lot of discussion around stormwater. We are looking at being more aggressive with pushing down our fund balance by having more expenditures. Stormwater Department is really making a note that we need to further engage with POAs and such to make sure that we are using a different sort of grading system to make sure that we pass on the funds that are so needing. So we're going to have another workshop on stormwater as well. So I encourage those folks that are interested to come and join us as we better understand this and improve upon the process, I think is what we're trying to do.
Okay. The next one is our CDC fund. On this one, there hasn't been a lot of activity on this one. We do have some investment income as it relates to our investments. It is trending higher, $76,000 higher than what we were projecting. Really nothing here to comment. It is what it is at this point, and we do have, it's about the same amount compared to 2024. So it's not there's a difference of $42,000, and again, that's because of the investment income revenue that we're getting. Any comments on this one? No? Okay. And then we have our expenditure side for the CDC. Here, again, this is, we have our operating costs, and then we have some professional services that we have utilized, and we have encumbered about $36.5 thousand for professional services. Altogether, we have actual $229,000, which we did spend a little bit more than the year before. Again, one of the things that to observe is the timing when our personnel started working here in the town compared to the year before. So that is the major difference. Of course, we have some operating expenses that are a little higher and new professional services that we have encumbered and we have spent compared to last year. Okay. Questions on this one? Comments? Again, same situation here as it relates to our housing fund. We do have a transfer from a state aid tax, and that's what that $1 million number there is. And of course, it's not there for the year before. And then no transfers from the general fund other than the aid tax. And again, there's not really anything here to really discuss other than unless you have any questions or comments. The next one is the expenditures. Again, this is also very small here. We have encumbered $1 million for the North Point. And then we have small expenses dealing with our neighborhood stabilization, and then of course our Bryan Road partnership of $900. But other than that, I'm sorry, I'm missing the last one, the last line, which is the housing program operating. We have moved some of our personnel expense into this housing line. Again, we're trying to, and I know the recommendation from town council was to make sure we have all our housing-related expenses in one place. So we heard your recommendation, and this is what is reflecting here, trying to put everything in the housing fund where it belongs. Comments, questions on this?
I'm going to defer any questions or comments until our housing workshop, which I understand will
Okay.
come up in July or August. So.
Okay. And then this is the consolidated view, but this one is in terms of fund balances, not budget balances, but fund balances. And then if I'm looking at the year-to-date revenues and the year-to-date expenditures, those lines, those columns should match what we have been talking about for the last few minutes. But I do want to bring to your attention, we're looking at fiscal year '24. Again, this is the whole year compared to part of the year as of April 30, 2025. Even for the 10 months that we have here, it shows an 8%, and I'm sorry, I don't have the percentage column here for you to see, but it is an 8% increase compared to the entire year for '24. So we are very strong with our balances as it relates to our fund balances for each of the major funds that we have. Comments, questions?
Oh,
I have a comment overall. Thank you very much for making changes to the report. I think you've done a very nice job of laying it out in a way that it is easier for us to understand what is happening. I would ask that you consider maybe on a quarterly basis showing the fund balances from not these major funds, but things like hospitality tax and TIF and, you know, all those, as I call them, below the line balances. It's amazing how many times as we talk about things, I go back to exhibits to see what that fund balance is. Like today, as we're talking about TIF, that's the first thing that entered my mind. What is our fund balance in TIF as we're talking about closing it out? So I don't think we need it every month, but it would be nice to see that from time to time during the year.
When do you want the first quarter to be? Do you want me to do October? Would be the first quarter to start talking about the special funds that we have, like hospitality tax, beach preservation fee. Do you want me to come in October and present that to you, or do you want it earlier than that?
Well, maybe if we could, when we close out the fiscal year, we could start there.
Okay. Well,
That
I can
makes
do that.
sense.
Along with that, we're looking at establishing a new policy for fund balances. It's already adopted on the first reading, coming up on second reading next Tuesday.
That's correct.
So I think it'd be good to see where we stand with regard to that policy as we do those quarterly reports.
Okay, and something that we, yes, and something that we also bring into your attention next month will be the new tax policy and process. So that's something for your review, and hopefully the what we're proposing makes sense for our community and for us here. Questions, comments?
no questions, Ms. Burnett. Before you leave, I want to offer Councilman Alfred opportunity. No questions, no comments. Thank you, sir. Okay.
Thank you.
Job well done. Move on to new business. Consideration of a resolution of the Town Council of the Town of Hilton Head Island, South Carolina, authorizing the town manager to apply for funds from the South Carolina Opioid Recovery Fund Board, authorizing the distribution of any funds received from the South Carolina Opioid Recovery Fund Board, authorizing the execution and delivery of an opioid recovery fund use agreement between the Town of Hilton Head Island, South Carolina, and the Low Country Alliance for Healthy Youth Incorporated. Our very own Chief Blankenship. Welcome, sir.
Welcome. That was a mouthful. But today it's going to be a little team approach. We're actually going to explain to you what all that means. So what we're looking for is a recommendation to take to full council the resolution and the MOA on receiving those funds and distributing them both internally and externally. So today, my Battalion Chief of VMS, Peter Genera, is going to present. It's going to be a three-part presentation. It's going to be a little SCORF overview of what the fund is, how we will use it internally, our partnership with the Low Country Alliance, and then Michelle Bunce, our Senior Grants Administrator, is going to come up and walk you through the application process. So with that, Chief Genera.
Well, first, thank you for allowing us to take the time to come up here and present. We appreciate that. Kind of what Chief Blankenship just said, I'm going to start with the program is built with Low Country Alliance for Healthy Youth. It is a partnership that we're going to do with the funds that are going to come in. So, really, just get back to what SCORF is and where the funds came from. It was a $50 billion settlement that involved a lot of manufacturers like Johnson & Johnson and Purdue Pharma and distributors like McKesson and retailers like CVS, Walgreens, everything like that. So $50 billion, and then they were distributed out to the states. Hilton Head already has about $331,000 allocated to us so far. And so we needed to find a way to take those funds and implement those in the community to help output for those with opioid needs and mental health needs. So the funds originally, they are going to go through 2029. 85% of the funds are going to go to counties and municipalities, while 15% stay in a discretionary fund. And then after that, 2030 and beyond, it's about a 50-50 split of those funds. And Michelle Bunce will go into it later about how they are spread out and how we get them each year. A little bit about Hilton Head, the numbers we have here. These are just overdoses. So from 2020 to 2024, a 5-year rolling average, we've had about 107 overdoses here on the island. 65% are male, 35% are female. And about the average age of somebody having an overdose here is about 42 years old. It's important to note, really important to note, that about 50% of individuals who have mental health issues also at some point in their life will have some sort of substance abuse disorder or dependence. So that's why we're going to tackle both the opioid issues that we have here, also mental health. Okay, so the purpose of the program is really for us, for fire rescue. I'll talk about us and what we have first, and then we'll kind of bring in our partnership with Low Country Alliance for Healthy Youth. So we're more of an outreach team. We're always out in the field. So we focus specifically on people who experiences opioid disorders and co-occurring mental health issues. So what we're going to do, we're going to first connect the overdose survivors to treatment. Not just hand them a pamphlet, but actively link them to some sort of recovery program. Second, we engage their families to give them support, education of how they can look out for loved ones and what to expect. Thirdly, our ultimate goal is to reduce opioid overdoses and lessen the strain on EMS. We're not just treating symptoms, we're intervening early and working to create a long-term impact solution. This approach supports public health, reduces emergency response load, and saves lives. Why the program is needed? Well, I think it's very important to know that in the past, we've responded to all sorts of mental health people who were struggling and had overdoses, and we would just take them up to the hospital. They would be treated up there and then ultimately returned back to their home or their environment where they've had no support. So for us, we are the ones in there that can recognize that these people need the help and the assistance. And so I'll talk about the referral program in a little bit. Another reason that this program is needed is that the traditional campaign awareness, where it's just the flyers and talking with mass groups sometimes doesn't resonate. And we are out there identifying those who are truly in need. And so our providers will be out in the field, and they will put recommendations or referrals up to us if they see somebody who's in need. So for the referrals, one's going to come from QA/QI. We've got our EMS captain who reviews 100% of our calls. So if he notices anybody in those reports where are well-written, anything about mental health illness or abuse or substance abuse disorders, we're going to flag those. And they are going to go over to our team, our substance abuse disorder team and mental health team. Another way we get it is for those responders who are actually out in the field and identify it, then they'll also make that referral to our team as well. So how the program's going to work is we're going to reach out to the individual, whether it's brought in through QA/QI or from the boots on the ground, within 24 to 72 hours. This is the critical window. The patient is no longer in immediate crisis, but the experience is still fresh. They may be more open and receptive or engaging in conversation about recovery. 2, the follow-up is conducted by a joint visit between our peer support specialist and our EMS lieutenant. This pairing is really intentional. It brings one person with experience and trust while the other has medical knowledge and public safety credibility. So together they provide an education on overdose prevention, distribute Narcan kits, and offer treatment navigation, helping them connect them to places like counseling, medication-assisted treatment facilities, or social support. A key strength of this program is just the long-term commitment that we're going to provide to ensure that everybody in this community doesn't slip through the cracks. By having this team, we can run follow-ups periodically or throughout the year. For those dealing with co-occurring mental health issues such as depression, anxiety, or trauma, our outreach efforts aim to connect them with the appropriate behavioral health services, not just support substance abuse and treatment. Recovery isn't linear, and mental health must be addressed alongside addiction. We also recognize that those families are going to be greatly impacted. So we're going to provide them with the resources, support, Narcan training, and empower them to reduce their own risk of burnout and secondary trauma. Like we said before, this program moves well beyond the slogans and pamphlets, and we bring it right to the individuals here in the community. We also tailor it to those here in the community. We've run a lot of data to see how many we have in the area with mental health issues. I didn't even put that number up there because it was so high. You could just knowing what's going on in this world, in this nation, and here locally, it's not that much different. This model is already proven to save lives. With these outreach models, you see a 60 to 80% increase in treatment engagement. You see a 35% reduction in repeat overdoses, and there is a return on investment to the healthcare system and also on the patient. So dug and did a little research here. So there's 3 agencies up there I want you to see. It's North Carolina Peer Outreach, New Britain Recovers, and Clark Cowitz Fire Rescue. They have implemented this similar type of strategy where it's an outreach program paired with an outreach awareness program. And in North Carolina, they saw 35% fewer ED visits and 38% fewer hospitalizations. In New Britain, Connecticut, they saw a 51% drop in opioid deaths. In Clark Cowitz, they've seen a huge reduction in 911 calls, which is immensely beneficial to our area, which we seem to run more and more EMS calls every year and year. So what we're asking for our outreach program is $93,000. $83,000 of that will be towards some sort of vehicle. Also, we need equipment in the vehicle. It might get to the point where we need blood testing kits, Narcan, some sort of, if we decide to pair up with any sort of pharmacist, we will be with our med control physician, and we could possibly subscribe Suboxone or buprenorphine or anything like that to help them in the event we can't rapidly get them in a treatment facility. So we can kind of Band-Aid it until they need to get to the appropriate facility. For the two staff, the EMS lieutenant and the peer support specialist, just overtime with dealing with that. Right now, our EMS lieutenant is 5 days a week, so it wouldn't be much any overtime with that. It would be bringing in our peer support specialist. And then training and certification. That's to go get the proper training they need and certificates. I think it's really important if we're going to do that, that we can back it up that we have the proper training. Just want to talk a little bit about a success story, and this is kind of our champion who's going to run the program. This is Jason Robar. He's been with us for a long time now. He had battled addiction for over 2 decades. He found recovery at 35 and now has been sober for nearly 15 years. His turning point came when someone got him into treatment, and others in the recovery shared their experiences with him, giving him hope when he had none. Since then, he's helped nearly 200 people across treatment through nonprofit he co-founded, and today he continues to serve both inside and outside the department, mentoring individuals and leading recovery groups. His story is a living example of the impact we can have when we meet people where they are, with compassion, lived experiences, and a real path forward. It's not just part of the solution, he is the model we're building from. So in conclusion, we are putting together the complete package, like has been successfully done in New Hampshire, New Britain, and North Carolina, along with Low Country Alliance for Healthy Youth. And that will be our model here. Any questions?
Okay, thank you, Chief. Start with you, Ms. Bryson.
First of all, wow. It's terrible to have such a problem in our country with addiction and mental health issues, but to have the availability of funding and a program that you've put together, wow. I'm supportive, I appreciate what you've put together and highly supportive of it. And I look forward to hearing from the rest of the team. And I understand your use of the word team means your teamwork with the Low Country Alliance. It's wonderful to see teamwork in our community in trying to address an issue for our community. So thank you.
Thank you.
Summer.
Yes, I'd like to thank everyone for bringing this proposal to us, to Hilton Head. You know, opioids impact communities, and sometimes you like to think that you're immune from it, you know, and you think it's in someone else's community, but it's in our community as well, and it's all over the country. And so these types of programs aren't just about financial resources, but really it's the opportunity to prevent and support people. I do want to shout out for the data-driven piece. You're always data-driven. And so I appreciate that you're able to show that these programs have a measurable impact in a positive way on people's lives. And one of the things that I really like about it is that it's not just about getting someone into treatment, but also the mental health support, which is in the long run going to be the savior to whatever ails a person. And so I think that is a real holistic approach, and also the support for families as well, as it impacts everyone in the family and extended family. So thank you.
Absolutely.
I concur with the comments thus far. You mentioned that there's sort of this critical stage, you know, when an event is fresh, and that's the time that we want to make sure that we are moving towards some type of treatment. And you mentioned facilities. Can you just help us understand where such facilities may be in proximity to our island?
Sure. Those are very hard, and we don't have many around us. I mean, they might have to go out past Columbia, Greenville. They're not close. And those who might be on Medicare or other insurance plans. It's extremely hard to do that. That's why we thought it'd be important to, in the meantime, while we find placement, that we still have the ability to provide that peer support while we get them placement. And I don't want to get too far ahead, but with funding that comes annually, we want to see what our gaps are going to be. Maybe a lot of people don't go into those facilities because they don't have the means, and maybe that would be a great opportunity to use some of those funds to help them get the help they need where they really wouldn't because of financial burden.
So do we think that transportation could also be a barrier because of the distance that one would have to travel? Yeah. As usual, I'm planting seeds here. Obviously, this is just the start of a program.
Absolutely.
And I agree with you, as more funding becomes available, we have a broader conversation about how we get past, as you've lined it up in your slideshow, past step 3, right? So it's still limited as to what we can do. But understand that obviously there's an issue, and potential resolution is the more important piece of it. So just wanted to bring that to our attention and to our public's attention. So, all right? So we're going to
sir.
have the rest of the team come. But before you do that, I want to make sure that Councilman Alfred is good with any questions, sir? No? Okay.
I'm going to go into Dr. Novence. I'm going to run over her Low Country Alliance for Healthy Youth, just give a quick brief overview of what they do here in the community for us. And then I'll ask her to come up with any questions after that. And then we're going to go Senior Grant Administrator Michelle Bunce is going to finish up the last part about how often we need to report and how often the funds come in. So she'll kind of finish that up. Okay. All right, so our partnership, like we talked about before, is going to be with Low Country Alliance for Healthy Youth. And they are a long-standing coalition focused on promoting healthy, drug-free lifestyles for youth and families. Their work has historically emphasized education, community engagement, and positive behavioral choices. With opioid settlement funding, Low Country Alliance is proposing evidence-based programming and services that directly support substance and prevention and mental health initiatives. These investments would help reduce long-term opioid misuse risks, particularly in younger population, ultimately lowering burden on emergency services, healthcare systems, families. And this is proactively addressing the problem upstream through prevention and youth engagement rather than waiting until intervention or crisis is needed. Okay, a little bit more about them. The coalition, they are the only coalition in Southern Beaufort County focusing on youth substance abuse prevention, and they operate by bringing together all sectors of the community: law enforcement, schools, parents, healthcare providers, youth organizations, to address the problem collectively. Low Country Alliance Healthy Youth has a track record of success, including receiving highly competitive drug-free communities federal grants. This award recognizes their strength in multi-sector collaboration and supports long-term data-driven solutions that reduce the use of substances like alcohol. They also have multiple examples of measurable outcomes. The approach here is local problems require local solutions, and that's exactly how Low Country Alliance for Healthy Youth operates, by uniting stakeholders around prevention, early intervention, and promoting young mental health and resilience. So these are some of the activities and programs that they have. They have 7 proven community strategies to reduce youth substance abuse and related risks. These include public education, skill building, peer support, and improving access, especially in Spanish-speaking communities. They also support law enforcement with compliance checks, recognize businesses that follow the rules, help schools post health messages, and even work on changing local policies, like getting vaping added to smoking ordinances in Hilton Head and Bluffton. It's a full circle approach from awareness to action, already working in our schools and communities. And so with the use of the funds, you need to write them to the approved uses. So these are kind of the approved uses up top that's in black, and she wrote to the goals underneath. So part of it is the implementation of public health awareness, educate year-round drop-off locations for medications. Another one is to remove unused prescription opioids from circulating in the area. She does that, they do that providing these bags to get rid of the medications for disposal. Another one is to be involved in faith-based communities. There's a couple more she has. To educate parents and caregivers, to train teens for healthy youth chapters in middle school and high schools and their peers, and also train youth serving at the Boys and Girls Club, Island Rec, and faith-based programs. And that pretty much sums up what I had. Do you have any questions for me or for Dr. Novintz?
Okay. Donna?
Yes, so I love the mission of preventing young people from taking drugs and getting on this addiction path. So I think it's so complementary what the two organizations are doing. You've got prevention on one end, and then supporting the person in the throes of addiction on the other end. I did have a question though, because your organization covers a broad area. Is this grant to be used just in the Hilton Head area or in the broader community?
We did discuss that, and I know that the boundaries of our federal grant is only Southern Beaufort County, so that would include Bluffton and Okeechobee. We do not have funding opportunities for Northern Beaufort County, so it's only Southern Beaufort County. If you look at some of the programming that has been proposed, especially around PSAs through media such as WSAV, it will reach beyond Hilton Head. The focus will be Hilton Head. I've already talked to WSAV, but they don't have control over the programming, but as they agree, as we do and I do, is that it's great to have outreach because many of these people work in other communities and work here, or they live here and they work in another community. So the information will be received by others. When we look at the schools, we also work with our school district, and we have representation on our board from all of the 12 sectors. And the district does support us, supports the work with the youth and et cetera. So I think that that's a really great asset to have. And as far as faith-based organizations are concerned, you have many here on the island. And I think the outreach to them is important, especially through families, youth, and I would say, other ways of reaching the community and the congregation, which is, I think, a wonderful opportunity for all of the churches on the island to become engaged. And we do work with the churches. Also, we'll be having a faith-based breakfast in the fall. So this will be a wonderful opportunity to introduce them to the project.
Bryson?
I think it's a great program, and we've already seen the effectiveness of your young people in coming to us and saying, please amend your smoking ordinance to include vaping, which we did. They were very successful in their advocacy. So good work, keep it going.
Okay, well, the youth want to thank you for the opportunity. So thank you. But I would like to add something in support of a question that was posed about treatment resources. If you go to our website, we have a section on treatment resources and recovery resources. And through our grant, it's a requirement that we, of course, try to access as much information as we can. And he is correct in stating that we are limited in treatment resources that we have here, especially for youth. We do not have any inpatient or outpatient programs for youth in our county or in this region here. So I would like to share that information with you, and I do have access federally where I can find additional resources on treatment and recovery.
Yeah, let me get this out, Ms. Bryson, before I lose it. So thank you, Dr.
Thank-
Lewis.
thank you.
I just asked that, I understand, the next portion of this presentation, our grants administrator is gonna talk about how we report to the agencies that are pushing down the funding. I am more interested in how we report on this program back to this body, okay? To the point that was made earlier, Chief does a wonderful job with bringing us back data. But I want to encourage you all to collectively bring us back data that may not be so heartfelt, okay? Because we have to understand the gaps, okay? And as we talk about the youth, I'm glad that we have a program that's going to partner with the school district. And let's face it, I've got my coaching hat on here a little bit. There's a lot that goes on at the schools that unfortunately parents may not know about, okay? And we find out a lot through peer pressure and conversations at the school. And the fact that we don't have an opportunity for our youth to get the immediate treatment is a gap, okay? So whatever statistics come behind that, I think we need to say them out loud so we really understand what we're up against here.
Okay, thank you.
Yeah, I was going to say something about the lack of programs for youth, which it's a crying need. And the town doesn't, we're not responsible for the health department like the county is. But picking up on Mr. Brown's comment about the school system, it seems as though a partnership with the schools in asking the county to advocate for a local program, an area program for youth would be a good idea. And I would encourage you to try to do that because we certainly want to help the kids out. And if we don't have a program locally, I'll put myself in that community of we, need to work on it.
Yeah. I do have a question around a program for youth. And prior to that, I did want to share that Low Country Alliance for Healthy Youth has Teens for Healthy Youth chapters in all of the high schools, private and public, south of the Broad. And recently, the middle schools have asked to have some type of a Teens for Healthy Youth programming, and I'll tell you why they're concerned. The vaping issue is huge, not only in the middle schools, it's creeping down into the elementary schools. So again, thank you for your support around that issue. And we do think that's important. Our youth do a lot of peer-to-peer education, and they go into the Boys and Girls Clubs. So that being said, I'm interested in what you're saying about a county are you talking about a county program or a program locally here, which would create another concept for youth in addition to what we have?
Yeah, I heard you say something about a youth treatment program. That's what I was focusing on.
Oh, that's what you're, yes.
Right,
that's
yes,
what we're-
ma'am. I'm glad to hear about the other, but.
Okay, the youth treatment, yes, that's what we need to work on. I agree with you.
Yeah.
Because it doesn't exist.
I think
Okay.
maybe working with the county and having the backing of the school system to look for a treatment program. And there's got to be, the county's got to have a grant administrator too, and they can look for funding to try to take care of some area programs. I know in a lot of states, they pushed down and said it's up to the locals to solve mental health programs, and we're not going to solve it anymore. So it sounds like this is something else that's a crying need that perhaps the county or the region could take a look at. There's also the Southern Low Country board, Soloco, and maybe that's an idea that could be brought to them for that group to chew on and seeing about resources to make a treatment program happen.
Well, it's an interest and a concern of this coalition, and I'm talking about all of our board members. And we've done our research. Again, if you go to our website, you will see that we have tried to identify treatment resources for youth. And what I would suggest that we all look into is a model that's being used in North Carolina, and it is a high school. It's a high school for youth who have been involved in treatment and recovery. So there are models out there, and I would like to present those eventually to you. So.
Okay. Thank you.
Good afternoon. How are you?
Great, yourself?
Wonderful. It's close to Friday, right? So first, just wanted to thank both Peter and Dr. Novence. It has been wonderful working with both of them. Obviously, I have learned a lot working with that team. And it's very exciting to see the potential of this program for the community. So the first slide here, don't want to repeat what Peter's already kind of run over with you. The main part is the bottom, which is the application date, which is quickly approaching for us. It's July 3rd. This is the first one. There are several application dates that come available. They're open for 30 days. And the biggest thing for us is a technical proposal, which just outlines how we're going to utilize those funds. And then that's the project start date if we're awarded. So it goes on an annual basis. We apply once, but that is actually how our annual project dates will run for each year's allocation, is that October through to September date. So the important thing to note about these funds is this is not federal funding. So this was a legal settlement that the state is now, utilizing those funds to pass through to the local governments to use and nonprofits and others. So just to make a note of that. Sometimes we get asked, is this federal funding or state funding? But it is a legal settlement actually that happened, that Peter mentioned. And the total settlement actually for overall the nation was $26 billion, just to give you an idea of how much money there was, which was awesome. And then the state of South Carolina is more than $360 million at this time. So each year we will get a different allotment. I'll show you that on the next slide. So next couple slides. So our total allocation to date, this is actually an accumulation of years that's been there for a couple years now. It's $331,865. As I mentioned, it's annual allocations. They do come available in August to September, somewhere around that time frame, depending on how the budget and everything is going with the state. We do have to use each year's allocation within 3 years. If we do not use that money within the 3 years allocated date, then that money will go back to the other discretionary fund. So it does keep going, and it does get used for the same program, but just in a different area. So I don't think we'll have a problem spending that money though in our community for sure. December 2022 was when the town was allocated that first sum there, which is the $120,000, a little over that, close to 121. We do have to expend that. Its 3-year allocation date is coming up at the end of this year, which based on Peter's proposal and Dr. Novence, I don't think we'll have a problem expending those funds by any means. So excited about that. Peter had mentioned there's several allotments coming up, and at least till 2030, we do have how much money we're getting each year. That's what we've been provided. After that, we will not know at this point. But potentially they're thinking that funds can be all the way up to 2038. Could be longer, but at this point, they will only say 2038. But these are the different allotments that we'll have. So they do go down. However, hopefully, the program will be established and we'll have a better idea of how we can better, how those funds are being used and the best way to use them. And also keep in mind this particular type of funding, they do not have any restrictions on us using any kind of other matching funds from anywhere else, whether it's federal, state, or whatever. So that's a really good thing too. Gives us more flexibility. And then here, this is the reporting requirement. So it was a great question that came up about the reporting. We do have to give reports every 6 months typically, depending on when your project period starts is how that works. And then SCORF obviously has reporting that they're responsible for to the state. So it's a trickle-down effect for sure. But the nice thing is part of our agreement with Low Country Alliance for Healthy Youth was we did include in the memorandum of agreement reporting requirements. And it is more than just the data. We need them to tell the story. What exactly they're doing. Like, what are those numbers represent? Who are the people behind that? Where did you go? So we are going to be requiring that type of reporting from them, and then we'll combine it with that from Fire and Rescue to put a complete, more comprehensive report together for the state. So it was a great question, and that is part of our memorandum of agreement with them. So that was really it in a nutshell. That was my simple little part. These guys did all the hard work. But there again, thank you to Peter and Dr. Novence. It's been wonderful working with them. They're a great team and just excited to see what happens there.
Okay.
Any questions about
Bryce,
that?
any questions for Ms. Muntz? No?
Can you put the slide up that shows the amount that for future years? Yeah. So, so I understand we have to spend $125,000 before the end of the year, so we don't lose that funding. So each year you have to reapply.
No, you do not have to apply each year, so we're applying once for the allocation. That project date is basically like, once you get approved, your annual, your year, like start and end date for each year's allocation will be that October through September. That's how that will work. But you
Okay.
only apply once.
Okay, so that's nice. So
It's
you-
great, yeah, great
So you
question.
know, once you're approved, that this is going to be your revenue stream moving forward.
Correct.
So I just want to make a mention of you've got a request in here that is much larger than the annual amounts moving forward. And I know some of that is startup costs, so you're not going to be buying a new vehicle every year. It's less clear to me for Low Country Alliance, you know, what adjustments would be made moving forward because there'll be fewer dollars.
It's a great question, and we've actually kind of approached it a tad, saying that this first year actually will be a learning curve for us. So once we go through this first year, it'll be a great opportunity to look back and evaluate how the funds are being used, whether it's Fire and Rescue or Low Country Alliance, how they're best being used, and we can reallocate those funds as we see what the community needs really are to make sure we're meeting them. So it's a great question, and that is part of our process, is to evaluate that, to see how to best use these funds moving forward. Is that good?
Good here? Thank you, Ms. Bunson.
Thank you.
Thanks to the good doctor and Chief Gennaro and Chief Blankenship. I'll entertain a motion.
Sir, I move to recommend that the full town council consider adoption of a resolution authorizing the town manager to apply for funds from the South Carolina Opioid Recovery Fund Board, with the rest of the language included in item 5A.
I'll second.
Thank you. Any public comment here?
Yes, Mr. Zepfel?
Afternoon.
Hi, Gene Zepfel, live at 28 Golden Hind in Hilton Head Plantation. I'd like to talk about this just for probably no more than a minute. Great presentation, love the content, love the result, think we should do this. You had mentioned, Ms. Tunner, something about data and having good data. I think 2 points on the data. One, these are the folks that collect the data, real-time, first-order data. I think you have the opportunity to collect more data. Like, what portion of the number of incidents that happened were visitors versus residents? Huge difference. We get 3 million visitors, we all know. All the programs we plan on, whatever we plan on, are not going to really have much impact on visitors. So understanding how many Hilton Head residents actually have these problems, I think is important. So that's one point. Second point, the average age of 42, I think it was 42, was interesting. I had no idea. I was thinking it was much, much younger than that. These folks probably have a pretty good guess of what the actual distribution is. If the average was closer to 17 and 18, then designing programs around schools and around children makes perfect sense. We should do that anyway. But I heard no mention at all of any programs beyond schools. So what's the plan? If the average age is 42 and X percent are here living in our community, and we have no programs that were discussed, we should be thinking about what can we do to be able to help people with that age group. And even the youth programs, the doctor and the team, great, excellent stuff, but none of them really applied to the data set that we have. So I would ask that you, when you get your reports, ask for a little bit more data, and then understand how the programs really support the data. If we have 5 kids who have incidents in a year, that is a dramatically different problem set than if we have 500. I know we don't have 500, but I think you have the opportunity to data, which we rarely do. You have that opportunity, and I think if you could ask them to do it every time, that'd be really helpful. Thank you very much. Thanks for what you do.
Thank you. Yes. You want to respond? Please do.
I appreciate the gentleman bringing up that information because what everyone has not had the opportunity to look at is the details of our initiative. It is not only targeting youth, it's targeting families and other community members, senior citizens, et cetera. So when we are working with WSAV to create those PSAs, to create literature, whatever, it will target different populations, including the population that the gentleman referred to. And I will be working with Peter on that also.
Doctor, can you just, announce your website for the record, if you could, please?
Low Country Alliance for Healthy Youth. Darn it, I know I'd have it on the brochure.
That's okay. I just asked that the clerk include that information in the minutes, okay? And whatever package, makes its way to town council, we make sure that we have that information available for the public, please.
Yes. Let's see here. I guess I just go to it every day, so I'm not.
It's okay, we'll find it.
I have the QR code on just about everything.
That's even
now.
better.
I have the
Nowadays.
QR code. If you
That's
look at this
fine.
brochure here,
Okay, all right,
okay, thank you.
Thank you.
It's there, it's there.
okay. Any other public comment?
Okay, thank you.
Seeing none, we will bring it back to the dais. Any further discussion? All in favor? Okay, moving on to our next new business item. Consideration of resolution of the town council of the town of Hilton Head Island authorizing and ratifying the execution of certain redevelopment projects undertaken pursuant to the town's tax increment financing redevelopment plan, including projects in adjacent areas that directly benefit the redevelopment area, and provide notice to the taxing entities in accordance with state law. Mr. Colon, welcome, sir.
Thank you, Mr. Chairman, committee members. Sean Cole, Assistant Town Manager for the record. Let me explain what this is first and what it isn't. Well, let me say what it isn't first. This is not the reconciliation of all things TIF. We will bring forward a full account of the TIF from 1999 through the expiration in December of 2024 and collections through the end of this fiscal year to you later in the year. This is to reconcile where we have spent some funds outside of the defined redevelopment area, the TIF district, in areas that are adjacent to and provide benefit. Those expenditures provide benefit to the redevelopment area and district, okay? And we're gonna focus, since the extension, TIF extension, and it was amended in 2014, I included in the packet a resolution that describes what we're gonna go through the benefit of these expenditures to the TIF district, both within and for projects both within and those few that were outside the district. But I provided the 1999 ordinance, which established the original TIF district. Just as a reminder, it was a $65 million estimate for 15 years. Discussion around 2010 or 11 began about potential extension of the TIF. And it focused around three primary projects, which were the USCB hospitality facility, the delivery of Low Country Celebration Park, and the Chaplin Linear Park concept that would connect Shelter Cove across the inlet at Shelter Cove Lane where the law enforcement center is, and connect through Chaplin across William Hilton Parkway through Chaplin Park to both Singleton Beach and to Burks Beach. Those were the three primary projects that were included, as well as the objectives within the original TIF plan were carried forward in 2014. And so as a requirement of state law, Municipalities can expend funds outside of the TIF district, provided they adopt a resolution to include that accounting and how those expenditures benefit the TIF district or redevelopment area. I included in your packet as attachment 4, a resolution that was adopted in 2012 in advance of the amendment. But the Chaplin Linear Park concept really got a lot of momentum around 2010. The Chaplin Linear Park was connected to and adjacent to the redevelopment district. But much of the improvement was located outside the defined area. And so in 2012, Town Council went through and adopted a resolution that provided justification, including the benefits that investment in the areas adjacent to, but outside of the TIF area, would have within the TIF district area. And so we did this exercise in 2012. We've expended funds for the execution of Chaplin Linear Park shortly thereafter, and have expended some funds as we moved through to current date. And so when I get into the specific projects, expenditures, and location, hopefully I'm providing the context to move that forward. So most of our investment that we've made since 2014, since the extension, have been for projects within the TIF district. And in the staff report, we outlined, excuse me, an accounting for that. So investments in projects within the redevelopment project areas are broken down by some sub-areas. Our TIF district, while being one, let me pull up a map so you can see it. Our TIF district is defined by these areas outlined in black. Okay? So it's really it's a series of smaller areas or districts, but it was adopted as one TIF district in the 99 plan. The justification for that was there was a bridge to the beach plan that was done back in the late 90s. There was a bridge to the beach too, but it outlined a lot of improvements in this area down here on the south end. There was a Ward 1 master plan, which had 2 plans, initiative area plans that came out of that effort. And they were defined as the Chaplin initiative area. And so Chaplin initiative area includes some more. And in the staff report, it includes Matthews, Gardner within that. But this area here was the Chaplin Matthews area defined in the Chaplin initiative area plan. And then there was the Stony Initiative Area Plan. And I think these were adopted in 2001 and 2002. And so as those items were in development, similarly like we're talking about now, potentially for Stony or for Mid-Island, how can we identify a funding strategy to develop and implement projects? So as the conversations were happening in the late 90s, and leading into sort of the turn of the century, this TIF district was created to consolidate opportunities for investment in those 3 areas. And we had the justification in those plan documents that were in draft or well underway at that time. So they're not contiguous, but it is one TIF district. So as I go back to the staff report, when we talk about what I say the bridge to the beach or the southern section of the TIF district, that's what I'm going to start with here. And you can see, based on the 2014 extension, which was $50 million in 10 years, 2 of the first 2 projects outlined were USCB and Low Country Celebration Park. And as such, there's been a lot of investment of that TIF extension money in that area. So 48.7 million. And you can see the breakdown, right? 19 here, 11. There was some more money with roadway improvements. This first was really the roadway improvements that supported Low Country Celebration Park redevelopment. And then there were some other items here as we move through. Less investment in the other areas included in the TIF district since the extension. And it just means investments using the TIF funds. There's been other funding sources that have been used. But in the Matthews Gardner area, 55,000 towards streetscapes. In Spanish Wells, which is in the Stony area, just a little under $300,000 for traffic signal and investment in the old schoolhouse park. And then in Chaplin, there was some pathways and roadway improvements that were made within that section. So about $49 million investment there. And so those are projects that were within the redevelopment areas, which are authorized for the use of funds without additional notice or resolution. And so let's now focus on the next section. So in that same period, since 2014, there's been roughly $2.14 million of TIF funds invested in projects or portion of projects that are just outside of the TIF district. And this table in the staff report itemizes the list of where those expenditures have occurred, okay? And I'm gonna make a point about the Shelter Cove Boardwalk and park expansion. But at the top of the list is Green Shell Park. It's immediately adjacent to the TIF district. It shares the boundary with the TIF district. The property next door is within. The town in this period, 2014 to current date, has spent $44,000 of TIF funds investing in that property. There's a description of the benefit that it provided. There's recreational opportunity, there's access to cemetery, there's sensitive property there, and we put in the staff report a summary of the justification that was included in the resolution. And I'm not gonna go through in too much more detail, but to let you know, this is immediately adjacent to the TIF district. The town spent $44,000 in the last 10, 11 years of TIF funds toward the Green Shell Park property, okay? The next one was Chaplin Community Park. And let me pull up the map again. So when the TIF ordinance was adopted, the state code at the time limited land area to 5% of the municipal limits. There's no longer that provision. So many times large land blocks were excluded, like Chaplin Park, like Crossings Park, like cemeteries, areas that you carve out because they were already developed at the time, and there was not a lot of investment contemplated by 2014, the original expiration of the TIF. So I want to point that out. At the time of the adoption, Mid-Island was owned and operated as a golf course. So when we look at these projects and where they're located, Chaplin Park, as you can see, this black line runs along William Hilton Parkway and property line at Chaplin Park, but Chaplin Park isn't included within that area. But we know investments in what we'll call Chaplin Linear Park, which will connect all the way from the Shelter Cove Park expansion site, which is here, if you can see where my mouse cursor is, connecting along Broad Creek. We've made investments here, we'll talk about in a second, an amazing boardwalk. And the plan in Chaplin Linear Park was to provide a bicycle and pedestrian connection over this inlet to tie Shelter Cove area to the Chaplin area, and then to bring Chaplin Linear Park through Chaplin Park and have access to both the Singleton Beach or Collier Beach and Burks Beach, connecting the Shelter Cove community all the way to the ocean. So again, Chaplin Park proper was not part of the original TIF district, but it's immediately adjacent to, and investment in Chaplin Linear, or Chaplin Park will provide a benefit to that district, okay? The third one, and there's an asterisk here, and it's because of the 2012 action by town council. So in 2012, the resolution included in your packet, it put the public and our taxing partners on notice that we plan to invest some money, TIF funds, in this Chaplin Linear Park, where a portion of the project was outside the district, but would provide a benefit to the district. And so when I look at the numbers, we invested $1.5 million of TIF funds in the last 10 or 11 years. Most of that investment was on the boardwalk that I pointed out, okay, in this area. And I believe that that boardwalk has provided a benefit to the redevelopment area and is a first step in connecting to the Chaplin Linear Park and Chaplin community. So the reason I point that one out with special attention is I believe town council in 2012, by resolution, put folks on notice that we were going to spend some money outside the TIF area to benefit the TIF area. And we're including it here because I think let's have all of the accounting put forward in one resolution to finalize our position here. The next item is Mid-Island Tract. Again, Mid-Island Tract is this yellow area up here. You can see the TIF district wraps around. It touches Beach City, Dillon Road, and Union Cemetery Road. It was not town-owned at the time. It was a golf course. We've invested some money in Mid-Island Tract, TIF money. We know that those investments, and we've talked about what it is now, it's a stormwater-focused restoration to provide benefit to not just the property itself, but to a significant area of property and that section of our community. And so we've spent $342,000 to date on that project. Again, just adjacent to, but not within the TIF district. And then the final one where we've spent money adjacent to, but outside the district, is in Patterson Family Park. And Patterson Park is located, you can see, if you follow my cursor here, this is Marshland, this is Marshland Road. And the area in this, where my cursor is where Patterson Park is located. So you can see it's really across the street from a larger area that's included. And there's some area a little bit downstream on the marsh side that's been included. We've talked how that Patterson Park will provide a benefit, not just to the adjacent property owners, but to the entire, that entire area of our community. And so we've expended some funds. We've expended some funds, $13,000, toward the execution of that project. And so all in $2.1 million. I would say about 1.6 was previously authorized, and which only leaves a balance of about $500,000, which we've spent outside the district on projects that benefit the district, and are asking for town council consideration, for you to advance this to town council for their consideration to adopt this. We'll provide it to our taxing partners. There's no other obligation beyond that. And we will not spend any more funds, TIF funds, outside the defined geography as we expend the whatever remaining funds that we have. We had our bond counsel, Burr Foreman, prepare the resolution and work through with me and our finance team through Adriana to put together the resolution, the accounting, to meet the state requirements. We had our town attorney, Curtis Coltrane, review this as well, and we believe it's a step in cleaning up some housekeeping on some activity that occurred utilizing TIF funds in this fashion. So happy to answer any questions that you may have at this time.
Okay, thank you, Mr. Colon. Ms. Turner?
I almost don't know where to begin. You know, TIF is not a program that I am that familiar with. I have read the materials and I've done my own digging as well, so I've got some basic questions.
Sure.
So in regards to this specific proposal, this is money that has already been spent out of, and used TIF dollars.
Correct.
And have all of these been identified and communicated to the other entities as, you know, wanting to spend outside of the designated areas?
The only project that I would say we've communicated is the third one in this table via the resolution in 2012.
Okay,
When we looked back through our accounting, we saw that we had spent around $500,000 on projects in the last few years. And so this resolution provides a public report and accounting that we would provide to our the other taxing entities.
so when you communicate to the other taxing entities, is there any outcome that can come from that? Or is it just notification?
Now, and this was a point where we clarified with our council, we have to adopt a resolution to say, here's where we've spent funds on projects or portions of projects outside the district, but have benefited the district. And in that resolution, include the justification on the benefits that that investment had provided. And that's what's included it's in the staff report and in the resolution itself. We do not have any further obligation beyond that, and there's no recourse from our taxing partners at the county or the school beyond just the notification requirement.
Okay. You mentioned something about you had so much money allocated and you have $500,000 left. Can you explain that?
Yeah, I guess I did a poor job explaining. What I was saying is.
It's just a lot of material
Sure.
too, to
Yeah,
comprehend,
absolutely.
so.
So of the $2.14 million that we spent outside the defined area, in this table, it breaks it down. And in this number here, sorry about that. This number here, the 1.5 million, because of the 2012 resolution of council that said, we have this really cool project called Chapman Linear Park. It's within and outside the district. We're gonna invest some money outside. So that $1.6 million was what was expended to affect or implement portions of that project that were outside. So I think that we've already provide adequate notification. We did it in advance, in this case, in advance of spending the funds. So while this is taken care of, we've included it. We want a full accounting from 2014 until now of the money we've spent both within and outside the boundary. So this does that. What I'm saying is, in effect, we provided notice for the 1.6, and this resolution cleans up the remaining approximate $500,000 that we've spent now, and providing information after we've spent it. In this case, it's a little bit different.
Okay, that's clear in my mind now. Thank you
Okay,
for that.
all right. As long as I didn't mess up anyone else on that one.
And then, in regards to the TIF itself, so the program sunsets at the end of June, which I assume means that we don't collect any more money. Is there some type of time frame that you have to spend the money? Because when I went in and looked at the balance from March of this year and one of the planning documents, it had a balance of $11 million. So, is there a time limit on when you have to spend?
The answer is sort of. There, you have to have the funds committed. You don't have to have them completely spent out, but they've got to be committed. The TIF district had an expiration of December of 2024. The extension was December 14th of 2024. The expiration to collect funds is June of 2025. So projects where we've committed TIF funds, we can finish out. And so not spent, but committed is the term that's used in the ordinance.
How have we committed that $11 million that's remaining?
I'll ask Adriana to provide some context.
Yeah, that was March, so yes.
So the balance is actually about $4 million.
Okay.
So this is something that as of the end of June 30th, we're hoping that we can use some of that portion between now and the end of June. And then whatever is not used, then we will get carried forward that we will have to carry forward with fiscal year 26.
Oh, there you go.
In addition to that, one thing too, and this is a question that we actually have with our outside counsel about what happens if we don't use the money by June 30th. And the answer that we got is, we can spend another year not utilizing that money, but because we want to be good partners with our county or school district, the sooner we can utilize that fund, the better. But it's not that it's going to go away, but it will be partnership-wise, it will be the right thing.
Okay, but what projects have we committed to with those funds? Because I heard you say that you have to commit. So
That's
do we know
correct, so-
what are those?
Committed, and we have identified some projects that are located now in June that potentially utilize part of that $4 million balance that we have. And then the remaining money that is in the $2 million that we have is in 26. We don't have to necessarily commit, but we need to make sure we utilize that money as soon as we can.
And so the money, we reduced from 11 million to 4 million. We've got another 2 million. Those are, all those additional monies are being used in the TIF district? Because I thought you said that
Yes.
the money identified here is the only money outside the TIF district.
Yeah, as a staff operational decision, we are not spending any more money, confirmed with the town manager, that as of whatever date we started this effort, weren't going to spend any additional funds. So this became the final accounting of the utilization of funds for projects that were outside the district. So everything else would be invested within that area.
And are there any bonds associated with this that have not been paid off?
As it relates to TIF,
Yes.
I don't have an answer for you. Ooh. I don't have an answer for you at this point. I will have to get back with you on that.
That's all I had.
Ms. Bryson?
I didn't have enough time to try to figure out all my questions, so I apologize. You know, I think it'd be helpful for, we've already talked about this at our workshop about alternative revenue streams, to have an educational session about TIF. You know, at first I thought, is it somebody named Tiffany who gave us a lot of money? Or maybe it was Tiffany's jewelry store. I don't know. Who is TIF and what does it mean?
Sure.
And how does it work when you fix the tax base in 1999? But yet this money comes in from somewhere, from 3 different taxing jurisdictions. So I'm going to forget about that for now. I'm just going to say there's a lot I don't understand. I think we are where we are, and we have to figure out now what do we do. But before I go to now what do we do, I did want to take a look at the numbers, and I think I'm looking at the resolution in front of us. It seems to be attachment 1 to like the staff report. Is that the correct because the others have already been adopted.
Yeah, this resolution is what's before you today.
Right. So when I look at that and I look at Exhibit A, to that resolution. I'm noting, and I'm glad, thank you for the map, because I had no idea where Tiffany had her place. I thought it was all down in, along Pope Avenue. And you know, Mr. Cullen, I still have to remark about Bridge to the Beach. This really is Bridge to the Beach area. It goes all the way to the beach. But I see that, almost $8 million, was spent in that area. The two large expenditures, USCB, and then also Low Country Celebration Park. But then if you look at the Matthews Gardner redevelopment area, only 55,000. And then when you look at the Stony, based on the Stony Area Initiative Plan, Stony Island entrance redevelopment, only 277,000. So, I've got to think about when we look at these kind of expenditures in the future, to me, it's greatly imbalanced. I'll just say it that way. When we have so many needs in the Stony area. And I don't know why prior town councils and town management decided to spend the money this way, but when I see those numbers, it does raise questions in my head about what we're doing. But it's been done, and I'm glad Ms. Hunter was asking the questions about the money that's still there and the deadlines. It seems as though the June deadline is a kind of sort of deadline, kind of like your response. And as long as we can live with kind of sort of, and our bond council's okay with that, and we do what we can without just throwing money out the window, I'm okay with that. So, yes, please, if you can, respond to what I said.
So one thing that I do want to mention as it relates to the money that we're getting from our partners, as of 2/28/25, the county is no longer sending TIF money to the town because we have already reached the agreed amount. We still have about probably $100,000 from the school district that we should be getting in the next couple of months, and then that will finalize any additional TIF proceeds from our partners.
Yeah, so that's the coming in part, and I think what our concern is about, we have money that's already in, and how do we spend it if we're facing a deadline? But it sounds as though we're gonna try to spend some of it, and then the rest of it, we can do the carry forward to the next fiscal year, which seems like an odd thing to do when you have a deadline. But if our bond council is fine with that, and our finance director okay, then, I don't know what other questions to ask about that.
Yes, and again, the deadline is what is ending on June 30th is the agreement that we have. But we don't have to spend the money within the next 3 months. We'll have time to spend the money in the projects within the TIF district. And this is something that I did confirm with our outside counsel because I was concerned, well, June 30th is around the corner. Do we have to utilize the money? And that is not the case. We are going to try to encumber as much as we can out of the $4 million that I mentioned before the end of June 30th. But I can tell you now, based on the projects that we are seeing that we can potentially work on in the next 2 months or the next month, I guess, at this point, we're not going to utilize $4 million of TIF money. So we will have to carry forward the remaining, and hopefully we can utilize that money by the end of this calendar year, so we don't have to continue extending or carrying this balance that we have.
Let me ask this question then. We already went outside of the boundaries, and we're allowed to do that. Can we still go outside the boundaries as of today?
So my preference, and I don't know if Sean has a different opinion, but my preference is to continue utilizing TIF money within the TIF district.
Okay. Can you put the map back?
Yeah, absolutely. And let me just add just some context. The agreement ended December 24 collections. The latest we can receive the collections is June 30. We also have a budget that I hope you're going to adopt next week with a CIP that has some TIF funds programmed to projects. And so again, that is committed, Ms. Tunner. So, but our plan is not to spend $1 more outside the redevelopment area. It is to use what funds we have as quickly as we can. And on the projects we've programmed in the CIP for next year to exhaust that revenue source, okay? And I'll pull the map up.
Yes, if you could put the map up. And can you focus on the Stony area, Stony and entrance area?
Yeah, let me,
I don't know to what extent you can blow up that section of the map. Oh, hello. Okay, and what I'm looking for, I think I'm not sure what the hash thing, the green area, is that Coastal Discovery? To the right of the Stony area?
this
To my right.
is, this is Coastal Discovery
Okay.
Museum here.
All right,
Or Honeyhorn, the town hall property there.
Yes.
This is Jarvis Park.
okay, thank you, okay. All right, and so, I see the Cross Island, and then the next one over to the left is Spanish Wells, is that correct?
This is Spanish Wells Road.
Okay.
As you can see in 1999, Wild Horse Road did not exist.
Okay.
That was built
gotcha.
later.
Okay.
That connection.
So it looks as though the right boundary, if you will, starts at about Spanish Wells, and if you go on out to the left, it's where we move from Hilton Head Island to Jenkins Island. Am I
Correct.
reading that area? Okay.
Yeah, it goes to the causeway. And again, at that point, the town acquired Jenkins Island,
Yeah,
but really for preservation, I'm not even sure we owned it when this was created. But yeah, that's the district boundary, and it does run up Square Hope
Yes.
Road to capture really most of the waterfront.
yeah.
Side.
I'm just looking at the boundaries that are along 278.
Yes, ma'am.
Okay. And that's
May I-
within the TIF district.
May I also make another comment to answer the question that you had before? I didn't want to give you the wrong information, but I did get confirmation. We do have a TIF bond, and today, actually, we're paying the last payment of $3.9 million. So that will conclude that bond. Mhm.
So back to my kind of making sure I understand what we're doing today. It's considering recommending to the full town council that resolution, which is attached as number 1 to the staff report, which includes Exhibit A.
That's
All right.
correct, yes, ma'am.
Just want to make sure what we're doing. As Ms. Tunner said, there's a lot of information here for us to try to absorb, since we're like 20 years after.
And I tried my best to say, here's what this isn't, because I know a lot of questions about what is a TIF district, yeah, how does it generate revenue? We could spend all afternoon. I do have the answers for you, but let's focus on what's in front of us. I think that larger discussion about alternative funding, and because we're talking about the potential for a new TIF district or two, if we can provide that educational and an option for you to consider.
I think I think all of what you gave us was helpful. It's just we're starting from zero here. Trying to catch up.
And just one more comment. Yeah, when we looked at the accounting, certainly came across to me as glaring that we've spent $50 million on one end and 2-ish on another. All I can do is fall back on when town council extended the TIF, they identified 3 projects and they had them in priority order. USCB, Low Country Celebration Park, and they had big price tags, 25 million, 15 million, 10 million. So we executed the first 2 and part of the third. I think that's why there's that discrepancy. But we know better. We should do better going forward. And I think that's why when we're talking about TIF districts today, we're talking about Stony and Mid-Island. And there hasn't been a request at this point for area in the south part of the island. So.
Thank you, Mr. Chair.
Yeah, I just want to speak to Ms. Bryson's comments, and couldn't agree more in regards to the allocation of how the funds were spent, and that's why I made the comment about having a lessons learned post-mortem so that, we can identify things like this. So as we consider a TIF district moving forward, that we understand how we want to spend the money, where we want to spend the money, and then commit to that.
Understood. Yes, sir.
I concur with the comments as far as the allocation is concerned. I'll just remind us all that at the end of the day, political will is going to determine how things are done. And none of us were on council as these things were moving forward, but we are here now. So look forward to moving forward in a direction where we are taking into consideration some of the hard lessons that have been learned through this. And let's not forget the fact that the TIF funding that has been allocated has spurred into economic development. We've got new prizes on our island that we did not have before, right? So definitely a tool that has some positives around it. I'd ask Mr. Colon, as you bring this, if it comes out of committee, I'm making an assumption here, but I think based on the comments it will, that you also just include the answers to the questions that we've heard today. I think the debt question was a good question. Thank you, Ms. Burnett, for answering that, but please bring that up during the discussion. And as we adopt the 26 budget, if I hear you correctly, Mr. Colon, you have identified expenditures within that budget that could cover the current balance within the TIF fund. Am I correct in that? Or
Yeah,
at
we've
least
done
some
our
of it?
best to commit TIF funds where we could spend it within the TIF area toward projects for execution. And we'll confirm, there's a few moving parts when you have different entities and receiving payments but yes, we'll bring all that forward.
That'd be
Yes, sir.
good. I think that'll help us along the way when we get the full council. Mr. Alfred, anything from you, sir? Okay.
Chair, it might be helpful for perhaps the town manager to point out to us specifically where those planned expenditures are in
Absolutely.
FY '26 during the second reading next Tuesday.
I'll
You
make
will
sure to
communicate that,
mention
yes.
that to, yes, sir. We'll get the remaining funds that we have and where we have either encumbered or are programmed to spend those funds. And if there's $1 or more that aren't in one of those two categories, we will let you know.
Absolutely. I guess the only other question I have for staff is, I understand, what this is today, but we also mentioned that at some point, we're gonna do a total reconciliation of everything. Would that require some type of town council action as well?
Yeah, I believe that one requires as an ordinance to close out.
Yes, so it requires an ordinance, it's called a closing TIF ordinance that we need to have.
Okay.
As soon as we finish utilizing the TIF funds,
Got it,
yes.
okay. I think it's important to mention that along the way as well, so we understand.
Yes, sir.
What we have, okay. All right,
Are you ready for a motion?
I am so ready.
I'm looking over at our deputy clerk and I know she's writing hard. I'm just gonna say what it is in 5B. So I'm gonna recommend, move to recommend to the full town council consideration of a resolution regarding the TIF as set forth in full in item 5B.
And I second.
Thank you. Any public comment on this particular item? No? Okay. Any further discussion amongst committee members? Ready for the question? All in favor? Okay. Next up, thank you, Mr. Colon.
Yes, sir.
Public comment on non-agenda items. Any public comment on non-agenda items? Anyone signed up? Anyone want to come before? Seeing none, we will move on to item number 7. Adjournment.
I like that. I'm gonna go call Tiffany right now.
Okay, thank you to the public for participating today, and as always, thank you for our staff being so responsive to our questions as we move along. We are adjourned, ladies and gentlemen.